What is your biggest weakness, and how are you addressing it? This is one of the most common and challenging interview questions asked during pharmacy interviews. Employers use this question to evaluate your self-awareness, honesty, and commitment to professional growth. As a pharmacist, how you handle this question reflects your maturity, professionalism, and readiness to continuously improve in a high-responsibility role. In this video, we will explain how to approach and answer this interview question confidently, provide a sample response, and walk through a practical scenario that supports and reinforces the answer. By the end of this video, you'll be able to structure your answer confidently, avoid common mistakes, and give a compelling response that highlights your pharmacist-specific skills. The following are guidelines on how to approach this question. Employers ask this question to assess your ability to reflect on your professional development and how you take ownership of your improvement areas. They want to see if you can identify a genuine weakness, not a disguised strength, and more importantly, what proactive steps you're taking to improve. Your response should demonstrate self-awareness, problem-solving skills, and a growth mindset. Avoid giving cliché responses such as, "I work too hard," or "I'm a perfectionist," or selecting weaknesses that directly threaten patient safety, like, "I sometimes overlook small details." Instead, focus on a real professional challenge, such as time management during peak hours, and explain how you're actively working to improve through structured prioritization or delegation. Include key points like the nature of the weakness, steps taken to improve, evidence of progress, and how this makes you a more effective pharmacist. You could use professional phrases like, "I recognize the impact this had on my performance," or "I've since implemented a strategy to manage this more effectively," to sound clear and confident. If you follow these guidelines, you'll be able to respond to this question effectively and professionally. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. One area I've been actively working on is managing workload during high-pressure periods, particularly when the pharmacy gets very busy. In the past, I would try to handle everything myself, which sometimes slowed down efficiency and affected team coordination. I recognized that effective delegation and real-time communication with colleagues could improve our workflow. So, I've been using scheduling tools and daily team briefings to better allocate tasks. It's made a noticeable difference in how smoothly we run operations, especially during peak times. I'm continuing to refine this by seeking feedback from colleagues and tracking turnaround times. Example scenario. I remember when we had a flu vaccine rollout and the pharmacy was overwhelmed with walk-ins, phone queries, and dispensary tasks. I initially tried to manage the queue, supervise a trainee, and handle scripts all at once, which led to delays and some team frustration. I quickly realized I needed to delegate roles more efficiently, so I assigned the trainee to intake, the technician to phone queries, and focused on clinical checks. The shift ended much smoother, and the team felt more supported, which reflected in patient satisfaction. In conclusion, learning how to navigate this question is essential for any pharmacist interview. Practicing a well-structured and genuine response will set you apart and show your readiness for the role.